putting tickets in here?
I don't know. I'm an interpreter.
Oh, sorry. Good morning. Hey, good morning.
Good morning.
I know that. That's what I was saying. You guys wait. It's not like
2 minutes.
How are you? Are you an assistant?
Oh no, he's actually.
Cool shades.
Oh,
Are they yours?
yeah, I can't
Oh.
see you. They're actually just those ones that turn. Thank you for singing for me, man.
Yeah.
Appreciate you.
Well, good morning or good afternoon, everyone. It is a pleasure to be here. I'm joined by Baltimore County's Health Officer, Dr. Gregory Branch, who, after I speak, will follow to share additional updates on Baltimore County's ongoing vaccine distribution efforts and to be available for any questions. Dr. Branch, I want to first start by offering my continued thanks to you, to Deputy Health Officer Del Leister, and to the entire team at the Department of Health and Human Services for your leadership throughout this pandemic, but especially now, because in the absence of strong federal government support, it's been up to state and local governments to get the job done, and that's been true across the country. And that's exactly what we're doing here in Baltimore County. I had the opportunity to visit the health department's vaccination operation firsthand last week, and it is truly an impressive effort. Our staff are working around the clock and addressing problems on the fly to vaccinate as many people as possible as quickly as possible. Now, this work is even more impressive as we continue other critical work to address the ongoing pandemic, including both testing and contact tracing. In short, this is a massive undertaking, the likes of which Baltimore County and our entire country has never seen before. But we are proving that Baltimore County is up to this important task. As of today, more people in Baltimore County have been vaccinated than in any other jurisdiction across Maryland, including 11,000 people who have been vaccinated by our health department. We administered our first dose back on December 23rd, and those first responders and frontline healthcare workers who received that first dose are set to receive their second dose in the coming days. With Maryland now in Phase 1B, Baltimore County is set to vaccinate another 8,000 residents this week. As we ramp up to vaccinate even more residents, today we're also set to receive additional support from the Maryland National Guard, which is sending 9 individuals to provide clinical and logistical support to our on-site staff. I want to thank the members of the National Guard who earlier in this pandemic were critical in supporting our food distribution efforts, and for this latest support in Baltimore County's response to the pandemic. In addition, this week Baltimore County will be working with BCPS to begin vaccinating our educators as well as relevant BCPS employees. As prioritized by the school system, that group will employ those employees who will be involved in the first phase of learning of the system's return to instruction plan. This week, BCPS will also be sending staff to shadow our teams at the Timonium vaccination site so that they can learn best practices from our experts. This will allow BCPS to stand up their own vaccination clinics in partnership with the Department of Health in the coming days. We'll continue to collaborate with our partners at BCPS to ensure that all of our educators and staff have the opportunity to receive a vaccine as quickly as possible. We are also closely coordinating with all of our area hospitals who have been critical testing partners and with whom we are actively exploring opportunities to coordinate on vaccine efforts. Meanwhile, in an effort to reach as many people across Baltimore County as possible who are interested in receiving a vaccine, we've also launched a vaccine registration portal. This online form, which can be filled out in less than 5 minutes, allows people who live and work in Baltimore County to request notification for when they are eligible to receive a vaccine when appointments are available for them. The online request form can be found at baltimorecountymd.gov/vaccine. Again, that's www.baltimorecountymd.gov/vaccine. For older adults and others who might be unable to use the internet to make appointments, we ask that family members or other trusted individuals help sign up their loved ones for this registry and assist them in making appointments when asked. We're also asking any senior or other individual who needs additional assistance or who may not be able to have immediate assistance from others to please call us in Baltimore County at for help. We have staff on the ready to help connect seniors and others to sign up for an appointment and to have their information added to the registry. It's important to reiterate this point. Completing our online request form does not create an appointment for vaccination. Once you become eligible and once a vaccine is available, you will be contacted with information about how to schedule your appointment in Baltimore County. And remember, to get vaccinated, you must have an appointment. No one will be vaccinated without signing up for an appointment in advance, and you cannot register on site. Since launching our vaccine registry on Friday afternoon, we have already received over 72,000 registrations from people interested in getting a vaccine. More than half are adults over the age of 65. So to everyone who has already filled out your registry information, I'd like to say thank you for your vigilance, thank you for your help, and to everyone who has not, know that we want you to have an opportunity to sign up as well. To all of our residents across Baltimore County, we ask for your patience. Local governments are at the end of the supply chain. We, like all local jurisdictions, continue to face a severely limited supply of vaccine doses. We only receive a few thousand vaccines per week, including that moving forward, must include doses for that critical and necessary second dose for those who've already received their first. And while we remain hopeful that President-elect Biden's new efforts will help provide more vaccines to state and local governments, we know that for some time we will continue to face limited doses. So please continue to know that in Baltimore County, we will move with all haste to ensure that vaccines are distributed as we receive them. We will continue to reach out to those who have signed up to help schedule appointments once vaccines are in hand. And we will continue to do all that we can to ensure that no vaccine dose goes to waste. In the meantime, again, we ask for your patience, your understanding, and your partnership during this challenging time. Our neighbors are still getting sick, and they are still dying from this virus. And how we act in the days ahead, even as we distribute vaccines, will determine how many lives we save. While we are hoping this is the final stretch of this marathon, that is often the hardest. And today, Baltimore County reported a positivity rate of 5.9% and a 7-day case rate of 32.6, which is the lowest positivity rate in the state and the second lowest case rate. Even so, we remain above metrics set by the CDC for safe reopening, so the work continues. The personal decisions we make now continue to matter more than ever before. Our actions impact us, our loved ones, and every member of our community. While we're getting there, we are by no means out of the woods yet. So please continue wearing your mask, continue practicing social distancing wherever you can, continue that hard work of keeping yourselves and loved ones safe. Together we will get vaccinated, together we will crush and beat this virus, and together we will get back to life as we remember it. With that, I'm going to turn things over to Dr. Branch before we get to questions.
Good afternoon, everyone, and thank you, Mr. CE. Getting the COVID vaccine into arms is a major undertaking, but one that we in Baltimore County are completely ready for. I must acknowledge my health department staff for their hard work and commitment to addressing this pandemic. They continue to provide COVID testing 5 days a week, respond to the hotline calls from our residents, mitigate outbreaks in congregate care facilities and our schools. And they continue to be contact tracers, informing residents of potential exposures and helping them to successfully isolate and quarantine. And we are now vaccinating members of our community. We are happy to have the vaccine as the latest tool in our arsenal against this pandemic. But remember, vaccines don't save lives. Vaccinations do. And as the vaccine becomes more readily available, we must make sure that everyone signs up to be vaccinated. That is especially true for our African American and Latino communities. The virus has disproportionately affected these communities. Registering for the vaccine is easy, and the vaccine is safe and proven effective. So please go to the Baltimore County government website and register today. Registering will allow the Baltimore Department of Health to reach out to you to schedule an appointment when the vaccine is readily available. You must have an appointment to obtain a COVID vaccine. But another reminder, while we are happy that we now have vaccines, it's extremely important that we continue to practice the 3 W's. Wear your masks, watch your distance, and wash your hands. Do it for yourself. Do it for your family. Do it for your community. Please, just do it. Thank you.
If you are a week, I mean, if you will be 65 in a week, can you still register even though your birthday is coming?
We ask that everyone registers who's above the age of 16, yes. And then we would forward you the link as vaccines are available. Okay, so the vaccines for the nursing homes is done specifically by the state as it relates to their contract or the federal government contract with the CVS and Walgreens. So we are vaccinating with the with the nursing homes, but that's something that the state has those numbers on specifically.
And we're requesting those numbers from the state for a breakdown by the county, but we don't have that currently.
So if you register, once you're registered, you get a appointment. Are you a week out, 3 weeks out, a month out?
So once you register, we then send you a link so you can make your appointment, and then you'll know when you can get your appointment. So once you get your link, you can make your appointment.
Any word on how long you get the shot? I mean, I know you got 8,000, got a lot of people did.
Right, but at this particular time, we do not have enough vaccine to be able to meet the need. The supply is much less than the demand. So as soon as that supply goes up, I think we'll be fine and we can get people in pretty quickly. The rate limiting step is the amount of vaccine that we have.
Doctor, how much time between registering and receiving the link?
It depends on which tier group you're in. So if a person is going to be 75 or older, obviously we would be calling them in prior to somebody who's under the age of 64. But how long it will take for us to call that person is going to be dependent upon how much vaccine that we have. So we continue to be able to ask that the families of those communities and the friends be able to assist them. They can also call 311. And in addition to that, I think what happens is the fact that we'll be working with all of our partners in the community as the vaccine becomes more plentiful to ensure that everyone has access to the vaccine. Okay, so phase 1C, as in Charles, begins on Monday. But I will just say to you, from a practical perspective, we can talk about different phases, A, B, and or C. But at this particular time, we do not have enough vaccine to give to everyone right now.
Last question? Okay.
Those are the tricks that I have up my sleeve. We have a waiting list. And what we do is we can count the vaccines prior to ending our clinic. And if we think that we're going to have extra vaccine, what we can do is get more people in. So we never waste our vaccine. Oh, no, 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 no. We then try to remain within that phase, right? If I happen to have an extra vaccine or something like that, like one vaccine or something like that, I am going to put it into somebody's arm. I'm not going to put it into the garbage.
All right, thank you all.
Okay.
Thank you.
Thank you.